When a client first comes into my counseling office, the most important thing that needs to be ascertained is whether the person has mainly an emotional or traumatic problem or a chemical problem. Most people are on a continuum with that sort of index. So some of the problems are almost totally traumatic or emotional, and others are almost totally chemical, and then there are a lot in between. Now, the chemical part would also include any medical problems, whether there's a thyroid condition, because that can mimic depression, or if there's chemical dependence, which of course confuses the whole issue and needs to be dealt with before you can even find out what's really underneath. If I have somebody who has an emotional or a traumatic issue, I'm going to use a combination of psychotherapy and especially energy psychology, most particularly neuroemotional technique. And that is a quick and revolutionary way to take trauma that is stuck in the body out, and it relieves the trauma incredibly fast. If it's a chemical problem, in other words, if there's a chemical disorder, then what I need to find out is what neurotransmitters are involved. In mental health, there are several neurotransmitters that are most often involved with any kind of a difficulty. There are norepinephrine, dopamine, and acetylcholine, and all of those are excitatory neurotransmitters. They either quicken the electrical responses or firing of the neurons, or they add volume to the electrical response, and that tends to make people alert, focused, and helps with memory. GABA is an inhibitory neurotransmitter, and that slows the neurofiring, calming a person down. Serotonin helps not only to allow people to go to sleep because it's an inhibitory neurotransmitter as well, but it adds pleasure and is most often related to depression if it is low. Basically, what has to happen with humans is that there needs to be a good balance of the neurotransmitters. If the balance is off, a number of different symptoms could result. The person could be inattentive, they could be hyper-focused, they could have depressed feelings, anxiety, obsessions or compulsions, memory problems, depression, irritability, anxiety, or a combination thereof. If you find out exactly what's happening with a person on the first interview, and usually that's possible, then treatment tends to be more pinpointed and the results are much more successful than if you're floundering around trying to figure out what's going on and don't have it.